Welcome to Q&A with, a show where I focus on the role behind the person to give you some insight into how to operate in their world.
Hi, my name's Baz and I'm a mental health pharmacist.
Thank you for joining me today, Baz.
Thank you for having me.
Firstly, what is the role of a pharmacist and how exactly does the mental health aspect play into it?
So the role of a pharmacist is quite broad. We focus mainly on medicines, making sure that they're safely and legally prescribed, supplied and stored. The mental health aspect falls into it where basically I'm specialising in mental health. So my focus is mainly on mental health medicine, so things like antidepressants, antipsychotics, and I'm currently working in an acute psychiatric hospital.
Okay, so are pharmacists part of the NHS then?
So yes, I work for the NHS because I work for an acute hospital that's funded by the NHS, but some pharmacists might work for a private hospital, so that wouldn't necessarily be part of the NHS. Or some pharmacists work in the pharmaceutical industry, some pharmacists can work in local government. So it just depends on where you're working and whether you work for the NHS or not.
So are pharmacists allowed to make a diagnosis on a patient?
So it depends on what you mean. A formal diagnosis of, say, you have hypertension or you have bipolar disorder, that would be made by a doctor who's specialist in that area. But if you, say, went to your local community pharmacy and you had like a rash, or maybe you had, I don't know, yellow discharge coming from your eyes, then a pharmacist could say, oh, you need this cream. Oh, you looks like you've got conjunctivitis, you need these eye drops. So in that way, they're kind of diagnosing, but it's on a sort of minor ailment scale rather than a formal diagnosis.
With that, is there a limit to what a pharmacist can prescribe to a patient?
So pharmacists don't currently prescribe unless they've got the qualification to prescribe. So that's the non-medical prescribing qualification, which I'm doing right now. But there are pharmacists that are in university right now will qualify automatically as prescribers. But if you do prescribe, and it goes the same for any prescriber, whether you're a doctor, nurse prescriber, pharmacist prescriber, there tends to be a sort of limit. You wouldn't give someone a year's supply of medication and you wouldn't necessarily prescribe out of your scope of practice, what we call it, out of your specialty. You would prescribe with what you're comfortable and what you know well enough to prescribe.
What sparked that change for upcoming pharmacists to be able to prescribe now compared to back then?
So we are seen as the expert in medicines, and we also learn about the legalities of prescribing. So how to actually like legally write a prescription. So there was a lot of research done to show that pharmacists were good at prescribing, and pharmacists were sitting some of the prescribing exam that doctors did, and they showed that they did really, really well. So it became part of the curriculum that you qualify as a prescriber. But also it helps with the workforce of the NHS. It can take quite a while to get a prescription from a doctor nowadays. So having more people who can prescribe makes the system a bit more smooth.
So then what is the difference between a pharmacist and a doctor?
So I would say that we are experts in medicines, how they work in the body, how they're removed from the body, how they interact with other medications and other things. And we're good at sort of advising on what can be prescribed for certain conditions. I would say that doctors know a lot about the human body in general, and how it relates to like disease states. So therefore they're really good at like diagnosing and say, okay, because of this test or whatever, you have this condition.
Why the interest in being a mental health pharmacist?
So I worked in general hospital for like 3 years, where I just sort of rotated through lots of different specialties. And as I got to the end of those three years, I didn't find anything that I was like, you know, particularly drawn to, that I thought, oh, I could specialize in this and learn it a bit deeper. And then I sort of just fell into mental health, and no regrets, I completely love it. I've always found mental health quite interesting, and I've always thought that people with mental illness are sort of the most vulnerable people of society. So I always knew I'd probably work with them in some way. But yeah, now I've decided to sort of specialize.
Okay, so then what qualifications do you need to be a pharmacist, and what, I guess, experience or qualification or certification do you need to then pivot into a specialism?
So you start with your A levels, and I think unless it's changed, you definitely need at least chemistry and I think another other science subject. And then you go to uni, you do 4 years, which is a master's, so it's called Masters of Pharmacy. And then after that, you do a training year, which we call the pre-registration training year, because basically it's before you get onto the register as a healthcare professional, as a pharmacist. And in that year, you're fulfilling lots of competencies, doing lots of different things, and then you have an exam at the end. And if you pass that exam, then you become a pharmacist. In order to specialize, it depends on what specialty you want to go into. Generally, pharmacists who have gone into hospital will do a postgrad diploma, either a clinical diploma or a diploma in general pharmacy practice. And that just basically builds on the skills and knowledge that you learned at uni, but applies it to sort of work, like your day-to-day working. And then if you want to specialize in mental health, there's nothing specific that I've had to do apart from gaining experience in a mental health hospital, but there'll be lots of different things that will come up. So as I mentioned, I'm doing my independent prescribing so that I can prescribe medicines, and I'm specializing in prescribing antipsychotics.
Okay, what do you call it, a clinical
Diploma.
What is that, and what was the other one?
General pharmacy practice diploma.
What's the difference between those two?
So general pharmacy practice, aside from all the clinical work that we do, there's a lot of like governance work that we do. So making sure that medicines are supplied safely, stored safely and legally. So there's a lot of things that you need to do sort of in the background to make sure that everything's running smoothly with regards to medicines in a hospital. So we write a lot of policies and guidelines, a lot of like standard operating procedures on how things need to be done and how things need to be followed. So that's kind of what you learn when you're doing your general pharmacy practice. Clinical just it focuses more on clinical things. So you might learn more about gastroenterology, about pediatrics, about maternity, that kind of thing.
Whether it's A-level, a bachelor's or master's or anything after, is there any financial assistance from charity or the government or local government?
I don't know about any charities, but I know that if you're applying for pharmacy, you obviously get your normal sort of student loan, but I don't know of any sort of bursaries, like sort of like what the nurses had, where they can go to uni for free. That doesn't really exist for pharmacy.
And again, sticking with the qualifications you attain to become a pharmacist, is that also recognized internationally?
So in some countries like Australia, New Zealand, I could go over there and just practice as a pharmacist. But in most countries, you need to do some sort of conversion. So I know in Canada, you need to do a conversion. And I think Nigeria as well, you need to do a conversion. Equally, if you've come from Nigeria, you'd need to do a conversion here. So, yeah.
So in the UK, is a job as a pharmacist guaranteed?
So if you pass your exam, your pre-registration exam, then yes, as long as there are jobs available, which there tends to be. When you work in the healthcare profession, you're pretty much guaranteed to always have work available, but you have to pass your exam. And you have 3 tries to pass your exam. So if you fail the exam on the 3rd go, that's it. You can't be a pharmacist anymore.
You mentioned you've been a mental health pharmacist for 3 years.
So I've been a mental health pharmacist for a year, but a pharmacist, I'll be 5 years qualified this year. Okay. But I worked in general pharmacy.
For 5 years?
Yeah, for 3 to 4 years.
And was that, as soon as you got your master's, you were straight into work? Yeah,
so you have to do that training year, which you do get paid for. You do get paid for sort of entry level, you're sort of called a junior pharmacist. So you have to do that. And then, from then you're just working basically. Yeah.
And you work within a hospital currently?
Yeah, I've always worked in hospital. I've recently started what we call locuming, or what might people understand more as like freelancing in a community pharmacy, various different community pharmacies, just to get my experience in community, but I'm mainly a hospital pharmacist.
So then what types of employment exists for pharmacists?
There's loads, and I probably wouldn't even be able to list all of them because there's a lot of like little niches as well. But the general ones that people know about, you can work in a GP. So there's like practice pharmacists, and they run their own clinics and medication reviews. You can work in a hospital, and there's different types of hospitals. So I'm working in a mental health hospital, there's general hospital, there's all sorts of hospitals. You can work in community pharmacies, so like your local Boots or Lloyd's or independent pharmacy. You can work in the pharmaceutical industry, and there's lots of jobs within the pharmaceutical industry that pharmacists can do. And then you can branch out. You could go into starting up your own business. You could branch out into consulting. So yeah, there's lots of different things you can do as a pharmacist.
What about freelancer? Is that, what do you call it?
Locoming, we call it, yeah. So that's literally, you're not employed by anyone, you're self-employed, and there's lots of different apps and things that you can use to sort of go around to different community pharmacies and work shifts essentially, so you get paid by the hour.
And you was aware of all of that before you decided, I want to do just NHS?
So I was aware of probably community, industry and GP. Anything outside of that, no. And I'm still learning more about what I can do as a pharmacist that's not necessarily what I do now. But I knew that I wanted to at least start my career in hospital, because you learn a lot when you're working in hospital.
So working within a hospital setting, what is your day-to-day like?
So it varies from what I was doing in a general hospital. So I'll talk about what I'm doing now as a mental health pharmacist. So I usually start around 8 a.m., check my emails. There might be some queries, questions coming through from different healthcare professionals about advice on what to prescribe or how to prescribe it or supply or things like that. So yeah, spend the morning checking my emails, and then I'll go to something that's called handover, where I'm working on a specific ward, and all the healthcare professionals on that ward, we meet in the morning and we talk about all the patients, and we just talk about, anything that's happened the day before, any plans for discharge, any concerns or issues that there might be. So we sort of just all collaborate and work as a team. And then I spend the first half of the morning in ward reviews. So the patient comes in, I'm sitting with the consultant psychiatrist, maybe some junior doctors, nurses, and anyone else who needs to be there. Could be family members as well. And we're talking to the patient about their mental health, talking about their plan for treatment, just assessing them. And then in the afternoon, it just depends on what's needed. A lot of my role also involves governance, so making sure that medications are supplied and stored correctly. So I might be going around doing audits on the wards, making sure that they're following the procedures properly. Or I might spend my afternoon talking to patients, counselling them on the medication and if something new has been started, or talking to them about side effects, any concerns, carrying out assessments and things like that.
You mentioned you interact with other healthcare professionals, but are you able to let us know exactly the job roles of these other healthcare professionals you interact with?
Yeah, so I've mentioned the consultant psychiatrist. There's also another role called advanced clinical practitioners. So they could be pharmacists, they could be nurses, but they've sort of advanced in their practice. Also occupational therapists, so they're involved in sort of making sure that a patient can function, or assessing their function and how they'll be in the community, their daily living. So can they cook, can they clean themselves, how's their house set up for them, things like that. Also work with psychologists as well.
So what are your hours like?
So I do sort of 8 to 4 with a half an hour lunch break, but sometimes you're working through your lunch. But it's quite flexible where I work. Mental health tends to be a bit more flexible than acute general hospital, where you tend to do sort of 9 to half 5, but then you also might have on-call where you can be called at any time of the day or night to answer a query, or maybe you need to come in and supply medicines. So it varies, but generally I work Monday to Friday. I don't work weekends anymore. But if you work in an acute general hospital, you're probably going to work weekends.
How many patients roughly do you think you see in a day?
It's a good question. It depends on how busy the day is. If we've had quite a few new admissions, then those patients will need to be seen sort of within 24 hours at least. So it could vary from 3 to 5 to 5 to 7. It just depends.
Who are these patients? Are they people who self-check in or referred by a GP?
So they could be referred by a GP. They could be someone who has said that they feel really acutely unwell and want to come into hospital, but they would have had to have been assessed to say, okay, yeah, it's suitable for you to come into hospital, because not everyone needs to be treated in a hospital. Even if you're quite acutely unwell, you might be able to be treated at home. Say you've got a good support system at home, or maybe it would just be better for you to be treated at home. So they can be referred from community mental health teams. Sometimes we do get patients who have been brought in by the police as well, if something sort of drastic has happened. From various different places.
And what are the most common reasons why you would see a patient?
So me as a pharmacist, it's always to do with the medicines. A lot of the time patients have concerns about what they're taking. They get given leaflets, or, they might Google and they've seen lots of different side effects, so they want to talk about that. Sometimes it's just that they don't know about the medicines that they're taking, so they just want to know about it. Maybe they feel like they're experiencing certain side effects, so they want to know, is it related to the medication I'm taking or is it something else? So anything to do with medicines, really, I sort of counsel patients on how to take them appropriately. Also assessing patients on whether the medication is right for them as well.
And what is the most common, I guess, mental health issue you see patients have?
I think working in an acute mental health hospital, you see a lot of psychosis and seeing a lot of depression, a lot of like severe depression, depressive episodes. Sometimes I do see quite a bit of bipolar as well, but I would say mainly psychosis, schizophrenia, and depression.
When you say acute, what does that mean?
So acute basically means like, it's sort of, think of it like sort of like urgently unwell. Like it's an acute situation, it's an urgent situation that needs urgent attention or urgent medical care.
So, of course, as a pharmacist or a mental health pharmacist, I should say, you give medication that is prescribed from a doctor or GP. Can a pharmacist refuse to fulfill a prescription? And if so, why would that ever happen?
So, yeah, we can say that we don't want to fulfill a prescription because we might think that it's unsafe for the patient or it's not legal, the prescription is not legal. But generally, it's because we might think it's unsafe for the patient. And in that case, we talk to the doctor about it and come to some sort of, because it might be that, you know, we think it might be for something and the doctor's saying, actually, I've seen this study or I know I can use it this way. And then that way we can come to an agreement. But we can say, no, I'm not comfortable with this. Because at the end of the day, if we sign a prescription to say, okay, it's okay to be dispensed, we're also putting our registration on the line. So we need to make sure that we're comfortable with what's being given.
Could you ever refuse a prescription based on a personal religious belief?
No, you shouldn't do that, basically. I mean, people might, but they shouldn't. And actually, that's in our sort of like code of practice, that you shouldn't be refusing treatment because of your own personal beliefs. And if you have an issue, then you should refer that patient on to another pharmacist if you really say, I can't do that.
Okay. And is there a process or procedure in place for a patient to report a pharmacist?
Yeah, there are. There's I forget what it's called now, but you can report a pharmacist to the GPHC, and then they can be sort of subject to fitness to practice.
Okay, so if a pharmacist was to refuse to fulfill a prescription based on the fact that they felt it may be unsafe or just not quite right for the patient, are they allowed to offer an over-the-counter alternative?
Yeah, so they can offer an over-the-counter alternative if it makes sense, because obviously not everything can be treated over the counter. But yeah, they could do that, but it's not. They should definitely still have a conversation with that patient's doctor, because the doctor is going to expect that the patient's on a certain treatment. So you need to have that conversation.
Have you ever initially refused to fulfill a prescription?
I think there's been times when I've felt like I wouldn't order a medication or I wouldn't sign something off, or I might advise the nurses not to give it, working in an acute hospital, because I felt it's unsafe. That's definitely happened a number of times, yeah.
What is the hardest part of your job?
I think sometimes working for the NHS can be really difficult. Most times we're understaffed, so things aren't as smooth and seamless as they should be. That can be quite difficult. But I think more so working with mental health patients who come from really like sad, difficult backgrounds or just have a hard time hearing some of their stories can be quite difficult, and you want to help them as much as you can. And sometimes they don't want to help themselves. Sometimes they can't sort of see that they need help, and you can't force somebody to want to get better or to get better. So that can be quite difficult.
As a mental health pharmacist, how do you make sure your mental health is healthy?
I make sure I know when to switch off. So I'm the type of person that once I leave work, because I always make sure that I do what I need to do at work so that I can switch off. I don't like bringing work home. I don't like having stuff to do at home. I like to keep it very separate. And then I also make sure I enjoy my life as much as possible, live it to the max, go out with friends, chill as much as I can, have new experiences, just keep my work life and my personal life as separate as I can.
This may be controversial, but how do you feel, what are your views on those who seek non-medicated methods to treat their mental health?
So it depends on what you mean by non-medicated.
So let's say holistic type medication.
Okay. I think there's a role for holistic medicine in everything, to be honest. I don't think we should always be focused on treating with, classical medications like antidepressants. It's not for everybody, but I think it does depend on your symptoms and what you're going through. If someone's having a severe episode, having some vitamins and things probably isn't going to pull them out of that. And it's not to say that antidepressants definitely will either. They might have therapy or something, but I think a combination is important.
What would you say are the attributes needed for a mental health pharmacist?
So I would say you need to be able to handle stress. It can be very stressful, dealing with people who aren't well, but also working for the NHS is stressful. Working in healthcare in general can be stressful. I would say you need to be thick-skinned and you need to be able to communicate with people because you're dealing with people who have mental health issues. So especially if you're working in an acute hospital, they can be really quite unwell. They might say some things that can make you feel uncomfortable or shock you or even be somewhat abusive. So you need to know how to not take that personally and be able to still help that person. And then also I would say you need to be very organized and on top of things because things can move fast. And often, especially in mental health, we're sought after for a lot of advice, especially when it comes to medication. So, yeah.
Just for context, how old are you? And also, how did your parents feel when you told them you want to be a mental health pharmacist?
So I'm 27. And funnily, because I started off in general hospital, when I said I wanted to work in mental health, obviously I have Nigerian parents. So they were kind of like, why do you want to do that? Are you crazy yourself kind of thing? Obviously, now when I've sort of told them about my work life and what I do, they were still very supportive. It was just a thing of, oh, are you sure? And also, I think they were worried a bit about my safety because you hear sort of horror stories. But yeah, now, there's no issues. And obviously, I've been able to be safe at work and I've never had any concerns about my safety at work. So,
Have you seen any, issues that happen at work?
Yeah. I mean, we have to remember we're dealing with people who can be acutely unwell. Some people can be really aggressive. So I think mental health nurses probably get the brunt of some of the abuse and aggression. So yeah, I've definitely seen some things, but I think you just have to remember what you're there for at the end of it. So
Okay. To wrap it up, I would like to ask you, what song would you like to include in our playlist?
Chinese Farmer by Joe James.
Chinese Farmer by Joe James.
Yeah.
Thank you very much.
Thank you.
Thank you.
My name's Baz. I'm a mental health pharmacist, and you've been watching Osani TV.
Osani TV, it is a wrap.